CBS 2 is partnering with Susan G. Komen Race for a Cure cancer fundraiser taking place in Central Park this weekend. It's part of our commitment to community through CBS 2's Better Together campaign.
And recently I got to sit down with some experts and survivors to discuss how to increase breast cancer screening, especially in Black and brown communities.
Early detection saves lives. I know it sounds like a cliche.
Vina Morris is a two-time breast cancer survivor.
My journey with breast cancer started when I was like 35 years old, and I found a lump one morning.
She had a biopsy. It came back benign. Doctors removed it, and it turned out to be cancer. She underwent radiation. 6 months later, another mammogram, another cancerous lump. Morris had to make a major decision, which she documented.
My next steps are to do a double mastectomy with reconstruction. So today is the first surgery of 3, and I wanted to videograph this so that I have an opportunity to help others in my situation. I'm here with my mom. Check out our shirts.
Their shirts say, "In this family, no one fights alone." Rather than let cancer defeat her, Morris found the strength to help other women.
AfroPink is a nonprofit that's dedicated to bringing awareness of breast cancer in communities of color, particularly in the Black community. We have the highest rate of dying from breast cancer than any other race, a 40% higher chance.
Medical experts say the dramatically higher death rates, despite similar number of cases, is blamed on a variety of factors, including social and economic inequalities, limited healthcare access, and lack of information. That's why Morris partners with all kinds of organizations to bring testing where it's needed most.
Going to those populations, bringing the mammo van or, having a mobile screening can really help in that way too.
Another Morris, Dr. Elizabeth Morris, is a breast cancer researcher and also a survivor. She explains a mammo van or scan van is a traveling clinic that reaches people where they are.
It's important by the age of 30 to understand, do you have a family history of breast cancer? If you have a family history of breast cancer, you might need to start earlier than the age of 40. 60 to 70% of women get screened in this country. And I'd love to see it be 100%.
Working on the policy side at the Susan G. Komen Breast Cancer Organization, Angelica Katz says accessibility is one issue when it comes to screening. Another is financial.
Out-of-pocket costs can range from anywhere from $200 to $1,100.
That's why Komen helped enact the No Excuses Law.
What this bill does is it provides diagnostic follow-up testing at no cost for those with state-regulated plans. It allows over 200 facilities across the state to have extended screening hours, and if you're a public employee, you also are eligible to take leave up to 4 hours to get your screenings.
Katz's work is inspired by her family member Karen Ottamanelli, who died from metastatic breast cancer in 2010.
I feel like working at Komen, I continue her legacy and I can, help others.
These 3 survivors and supporters passionately advocating to make sure every woman gets tested.
And I absolutely cannot stress that enough. My mom had a breast cancer diagnosis last year. We'll be talking a bit about that. So early detection is absolutely key.
It's a great story by you. Such an important topic. So close to home for you, I know. And you're emceeing the event tomorrow, and that'll be so cool.
Yes, so we want to make sure that everybody knows that you can still sign up for the Susan G. Komen Race for the Cure. So it's happening tomorrow, 9 a.m. in Central Park. I'll be emceeing along with our own Jenna DeAngelis. John Elliott's going to be there as well. He's going to do weather from the route. So again, more information, you can head to cbsnewyork.com if you want to get involved and sign up.